they can go against gravity, so they can lift it up against gravity. You can feel that scapula track over the thoracic spine. How could you modify? What would you need to do for grade 2? Or a grade 1? What are the restrictions there? So, grade 5, full resistance. Grade 4, resistance either up to full or some. You know, there's that huge area in there. Grade 3 is with gravity. Is against gravity, no resistance. Grade 2 is they can move it without gravity's involvement. Grade 1 is what? We can feel a contraction, but it's not strong enough to move the limb. Grade 0 is no contraction. So grade 2, grade 3. Instead of pushing down on the arm, if you wrap under and support the arm, we're using our stabilizing hand to feel for that contraction. So if we give them some support and they can move it, then we've got the capacity. If they can track, if in supporting the weight of the arm, they can then move the scapula around, that's showing that we have the right activation of the right muscles. Or your hand's still in that position. If you can feel those rhomboids and middle traps firing, then you're getting into a grade 1 if they can't pull it around. But it becomes you applying a resistance or gravity, applying a resistance to the arm, to you stabilizing the arm because we're looking for motion at the scapula. Does that make sense? Okay. So as you kind of go over these, it's beneficial for you in studying to use your book, to look through and kind of see what kind of modifications, see if you can quiz yourself on how to do a grade 1, grade 2 modification, because it's going to help make sure that you understand the process of what we're looking for within that muscle. Okay? You good? Everybody done it? Clear as mud. Scapular depression and adduction. So we're trying to pull that scapula back down and back in towards the midline. Muscles. What's going to pull it down and back in towards the midline? Lower traps and middle traps. So that's going to middle and lower traps. That whole band is going to pull it in and back down. Make sense? Clear as mud? Excellent. So how do we want to do it? Lie on your stomach. So you're going to want to bring them towards the end of the table so their arm can hang out off of it. And you want their thumb up, like they're hitchhiking. So 45 degrees from forward flexion to horizontal abduction. Here, same idea. Relax, relax, relax. Now this one, bring it back around. You might want to kind of do that trick to put their arm behind their back to find that medial border. And that way you can kind of follow its rotation to get the right spot to make sure your hand's in the right location. So in this position, we're feeling for mid and lower traps. We're trying to make sure that scapula can move. So lift it up. There you go, and push against. And then we can kind of assess that we've got this thing, the scapula itself, moving and stabilizing the way it should. Okay? Ready, set, try it. So hand out at 45. 45 between here and over here. Thumb up. And they're just trying to lift it up.